Med Twitter is up in a buzz about a new clinical trial with some pretty jaw-dropping results. So this is a double-blind, placebo, randomized control trial looking at a new drug called retatrutide, which, when given to obese patients, helped them lose up to 24% of their body weight over 11 months. And this effect was dose-dependent. So the higher the dose they received, the larger the weight loss. And the highest dose was 12 milligrams, which is administered once a week. It's a weekly injection with a pen, kind of like an insulin pen, self-administered. So 100% of participants who got these 12 milligrams once a week lost at least 5% of their body weight. 93% lost at least 10% of their body weight. 83% lost at least 15% of their body weight. And 1 out of 4 lost at least 30% of their body weight. And their results go way beyond just weight loss. So more on that in a second. Just want to clarify first real quick that this trial is sponsored by the company that manufactures the drug. It's called Eli Lilly. And I have no affiliation with the company. They don't sponsor us. I don't get checks. I don't get payments. Financially, I don't care if they sell or not. Also, my position, as always, is that I don't dismiss science strictly on the basis of funding. I go through the study and I assess it like I would any other science. I want to see methodological rigor and I want to see reproducibility in the future. And another question that's guaranteed to come up, why are you even talking about drugs? Why are you such a pharma shill? Just tell people about a healthy diet. Yeah, that's 95% of our content. It's the name of the channel, right? And absolutely, if you can get the healthy body weight with a healthy diet and exercise, that's phenomenal, and you don't need a drug. And it works for some people. It works for me. I have no trouble losing weight just by being careful about what I eat. But we're not all the same. Some people struggle with obesity and overweight, even though they know exactly what to eat. I've heard even RDs, registered dietitians, explaining their struggle with obesity for decades. And these are the people who know better than anybody else how to eat to lose weight. And yet I've heard cases where they explain that it was only with the advent of some of these drugs like Ozempic, which you might have heard of, that they were finally able to eat in a way that's conducive to weight loss. So that's the realization. It's not these drugs instead of a healthy diet. These drugs aren't magic. They help control appetite so that people can eat the diet that they already know they have to eat. In fact, in this new trial, all the participants received counseling on nutrition and exercise. So the drug doesn't work in a vacuum. It's not, oh, I'll just take this pill and then I'll eat all the junk food I want. It's not like that. Okay, how do these drugs control appetite exactly? You might have heard about Ozempic and Wegovy. They're what's called GLP-1 agonists. GLP-1 is a molecule naturally produced in your body, and it signals the brain that you're full, that it's time to stop eating. So these drugs work like GLP-1, and they give your brain that satiety signal. Retatrutide, this new drug, is also in that family. It's also a GLP-1 agonist, but it also mimics a couple of other molecules like GIP and glucagon. And so overall, it has a more powerful appetite-suppressing effect than Ozempic. Now, several caveats to this drug and to this trial. First, this is what's called a phase 2 trial. It's done with a few hundred people, in this case about 300, and it's mainly looking at safety and looking at the doses to see which one might work best. But what's going to happen next is they're going to conduct a phase 3 trial, which is much larger. It's already in process. They're going to look at 1,800 people, and it's going to go on for almost 2 years. And there's going to be a lot of trials looking at these things in the years to come, looking at these different drugs, different doses, different populations, different outcomes. It's going to be intensively studied. So it's never, oh, here's the one trial, let's just trust it blindly and go head first. It's not like that. Second caveat is temporality. We do want to know what happens in longer time scales, 2 years, 5 years, even beyond. Are there side effects? Are there additional benefits? So future research is going to address those questions. Third caveat are side effects. We just touched on it. And they did report common side effects, the main one being GI symptoms like nausea, diarrhea, vomiting. And these were more common with the higher doses, and they were usually transient. They tended to go away after an initial period on the drug. The number of people who had intense enough adverse effects that they had to abandon the treatment was relatively small, 6 to 16% of participants. Caveat number 4, the weight loss is very impressive in this trial, but we want to know more detail. How much of that is fat loss and how much is muscle loss or lean mass? They didn't report that in this trial, but this is a common question with these drugs. We actually have a previous video going over this in detail for Ozempic and tirzepatide, and it's something that's very common. With weight loss via any method, there's usually a tendency to lose some lean mass as well, some muscle. So of course we want to minimize that, and the way to do that is to ensure adequate protein intake and some resistance training, to exercise with some weights. So looking forward to more information on that in the future. And my 5th caveat would be price and access. Always a big question. They're probably going to be pricey, at least in the beginning. It's going to depend on health insurance and where you are and your provider and all these things. So details are TBD. In general, my view of this class of drugs is that it has the potential to be groundbreaking. And I think what we'll see over the next decade or so, as they become more utilized and are improved upon, is we'll start to probably see the rate of obesity dip. And of course, with that, the rate of diabetes, of type 2 diabetes, will dip as well. In fact, in this trial, it wasn't just weight loss. The participants' blood pressure, their glycated hemoglobin, so hemoglobin A1C, their fasting glucose, their insulin level, their triglycerides, their LDL cholesterol, all came down, all improved on the drug. Of the participants that were pre-diabetic when the trial started, 72% were able to normalize their hemoglobin A1C. So they were no longer in the pre-diabetic range. Many patients were able to reduce or even eliminate other medications, like blood pressure meds, for example. These are all pretty common consequences of weight loss, and over time, everything else being equal, we'd expect this to lower risk of a number of diseases, type 2 diabetes, obviously, but also things like cardiovascular disease, maybe even some types of cancer. Now, is it true that if we stop taking the drug, we put the weight back on? Yes, that has been shown for the other members of the family like Ozempic. And I'm sure it'll be the case for retatrutide as well. So it's like any other drug or any other diet. It works for as long as we're on it. The difference is a lot of people struggle maintaining a healthy diet in the long run, unfortunately. Will these drugs sometimes be overprescribed? I'm sure they will. Like any other tool, it can be misused, it can be abused, and the solution is not to get rid of the tool, it's to learn to use it better. Lifestyle should always be discussed and emphasized. And it's enough for some people. It's enough for me. I'm very lucky. For other people, these drugs can be an absolute godsend and a game changer. And used in the right place at the right time, they can change our health landscape. We covered Ozempic and other GLP agonists in this video, and this one talks about diets and weight loss and some of the common traps and pitfalls. Let me know your comments below. Take care. I'll see you next week. Bye.